knock, knock. Hi, my name is Kayla. I am going to be your nurse today. I'm just here to do a gastrointestinal assessment. Let me just provide for privacy and hand hygiene. And then if I could just look at your wristband and have you state your last name and date of birth.
Thielen, 7/27 and 99.
Okay, awesome. So throughout this assessment, just going to be having you lie on your back, listen to a few different places on your abdomen, and just feel a few different places. Does that sound okay with you? Okay, awesome. Then before I get started, just a few questions for you. Do you have a history of any food intolerance? And then do you have a history of any abdominal pain?
No.
Okay, awesome. Then we can have you lie down on your back. And then, do you want to scoot over this way a little bit more? Okay, and then if you just want to raise your shirt a little bit. All right, so just by a first look, looking at the side, the contour of the stomach is flat. There is not any lumps or bumps that are abnormal that I would not usually see. The belly or the umbilicus is midline and centered. I don't see any striae or piercings on the abdomen. The color of the skin is normal for race, and just touching the skin is warm to touch and moist. As far as the hair on the stomach goes, it's distributed evenly underneath the belly button, and the person appears comfortable and relaxed as much as they can be throughout the assessment. So first I am going to be listening. First I'm just going to listen to your vascular sounds. So the first one is the aorta, then the renal, then the iliac, and if you could just move your hands a little bit, we'll go the femoral, and then if I was actually doing it on a patient, I would make sure that the femoral was obviously on skin and not over clothing. So next, just going to listen to a few places on your stomach. Just have to switch this. Okay, and I did hear a bowel sound, so I can move on to the next quadrant, but if I didn't, I would continue listening for a full minute. Okay, heard bowel sounds over there. All right, bowel sounds are active in all four quadrants. Next, just going to be feeling a few different places on your stomach. Just going to warm my hands up a little bit so they're not so cold. So first, just going to be feeling, oh no, actually that's a lie. First I'm going to percuss. And you can hear it's more hollow, or if I were to percuss over the liver on the right side, it's a lot more dull sounding. And then over to the spleen on the left side. It's more dull when you are over the spleen and the liver. Now I'm going to palpate. So I use 3 fingers. First is light palpating, just going around in a circular motion and then moving clockwise over the abdomen. Again, I'm not feeling any lumps or anything protruding underneath the skin that I normally wouldn't. Okay, and throughout that facial expressions, he was not grimacing or anything like that. So there, from my understanding, is no pain. Was there any pain throughout that?
Mm-mm.
Okay, awesome. Then lastly, if I could have you sit up, just need to check your CVA. So just going to be striking the back of my hand on the lower part of his back. Just let me know if there's any pain. Do you feel any pain?
No.
All right, awesome. Then you can swing your legs back around. Do you have any other questions or concerns that you would like me to relay back to your doctor?
No.
Okay, awesome. Then I will see you later.
Awesome.